everybody, welcome back to the channel. In today's video I'm showing you the physical exam and as we practice for the OSCE, and with me is my friend and classmate Payton. She's going to help me through it and she's going to be my standardized patient for the day. I was really excited to film this so that you can see a little bit of what we do. I'm definitely not at the doctor level yet, but we're working through it, preparing for our OSCE that's going to be next week. So yeah, if you're interested, and just keep watching. I'm a first-year medical student here in FAU, and today I'm going to be doing your history and physical. Is that okay?
Yeah.
Awesome. And can I start by getting your name and age?
My name is Payton, and I'm 26.
Okay. Are you comfortable? The lighting, temperature, okay?
Yeah.
Before we start, do you need a chaperone or an interpreter?
No.
No. Okay. So what brings you in today?
I'm just here for a general physical.
General physical. Okay, awesome. So we're going to do a complete physical exam and then we're going to go from there, okay?
Yep.
So first is general appearance. So Payton seems to be alert and that she's not in acute distress, appropriately groomed and dressed. And we're going to take the heart rate and respiratory rate, so just sit still. And I'm going to use a watch the day of my OSCE. Okay, heart rate of 73 and respiratory rate of 20. Okay, and I'm going to be taking your blood pressure. Perfect clothing today. Have to estimate that. Okay. Estimate systolic. We're going to start with the cardiovascular exam, anterior chest. There's no asymmetry, no scars or redness on inspection, and there's no use of accessory respiratory muscles. And let's see, inspection of the back. No asymmetry, redness, or scars. Okay, so now I'm gonna percuss. Okay, can you lift your arm for me? Back, with the percussion. If you feel any pain or discomfort with this, let me know, okay?
Okay, will do.
Okay, so resonant sounds heard on percussion and all lung fields bilaterally. Now I'm going to palpate, and I'm just going to palpate the anterior chest for crepitus in between the ribs and then on the sides. Any pain with that?
No.
And in the back, can you put your feet there so we can see? I'm going to palpate the back, paraspinal muscles. Any pain with this?
No.
I'm just going to, since I'm here, I'm going to palpate the spinous process as well. Any pain?
No.
And percuss. All the way down. No pain, right?
No. No pain.
Okay, I'm going to go back. And I'm just going to take a listen, okay?
Mm-hmm.
I'm going to ask you to take deep breaths with your mouth open every time I move my stethoscope, okay?
Okay. Yep.
Again. Again. Can you lift your arm for me? One more time. One more time. Again. Again. Okay. Let's move this way for me, please. Thank you. And the same thing. Okay, perfect. Since we're here already, I'm going to check access for lung expansion. I'm just going to ask you to take a deep breath. Okay, perfect. Now we'll take expansion, and I'm going to ask you to say the words 99 for me every time I put my hands on you, okay? Mm-hmm. Go.
99.
More.
99.
Okay.
99. 99.
Here.
99.
Here.
99.
One more time.
99. 99.
I don't know where I should go from.
99.
Okay. You go this way.
Okay, let me get your tissue.
We have finished with the respiratory exam. And now we're going to do a cardiovascular exam. That's okay?
Yeah.
Awesome. So I'm going to have you lay down. Let me open this for you.
Shoes.
There you go. Okay, I'm going to start by inspection of the neck. Inspecting for JVP. Can you just go that way for me? The other side. Okay, now JVP observed. And I'm going to take a listen. Can you hold your breath for me for a second?
Yeah.
Okay, you can let it go. No bruits heard on auscultation. And I'm going to palpate for the carotid. Pulse is normal. Okay. So there's no carotid bruits on auscultation and no abnormal pulses. Now I'm going to inspect the chest. Chest is symmetrical. There's no scars, redness, masses observed. I'm inspecting the precordium for any palpitations. I don't see any. Now I'm going to go ahead and palpate. I'm going to start at the manubrium, going down the sternum, and I'm palpating for hips, lifts, or thrills. And also palpating here. I'm going to palpate for the PMI. Can you lift your breath for me? Like this, right? Mm-hmm. And I'm palpating for the PMI at the fifth intercostal space. And clavicular line. No hips, lifts, or thrills on palpation. And now I'm going to take a listen. I'm going to auscultate all four chest areas for normal heart sounds, S1 and S2, and I'm also auscultating for any murmurs. So first, the aortic area, pulmonic area, second intercostal space on the left side, tricuspid area, left sternal border, and then the mitral, or can I lift this for you? Mm-hmm. The mitral area on the fifth intercostal space in the clavicular line. Okay, so I'm doing the vascular exam, checking for any cyanosis or any clubbing, and everything is normal. I'm also palpating for any edema on the shins, and then I'm palpating the pulses, right? The brachial pulse, radial pulse, brachial pulse. Really good pulses.
Thank you.
Radial pulse. Okay, so I will be doing palpatio. Can I get this up for you? And also here, there's all this pedis and posterior tibialis. I don't know if they're seeing posterior tibialis pulses. I'm going to do the abdominal exam, and I'm going to have you lay down. Please. And lay down. Awesome. And I'm going to have you position for me in this part. Normally we'll drape the patient with sheets. Okay. So on inspection, there's no scars, masses, or bulges in the abdomen. We're going to take a listen. Oops. Listen in all 4 quadrants. And then over the aorta, renal, and iliac arteries. Okay. Normal bowel sounds, 4 quadrants. Do you need to use the bathroom?
I do not.
Okay, so now I'm going to palpate superficially, 4 quadrants, and then a little deeper. Any pain?
No.
And we will also palpate the femoral areas for any lymphadenopathy or tenderness, but we don't do this in the standardized patients. And I'm going to palpate for the liver. Can you take a deep breath for me? Thank you. And then the spleen. Take a deep breath. Awesome. Try to get the kidney. And then the left kidney here. Awesome. And I'm going to now percuss 4 quadrants. Resonance in all 4 quadrants. And now I'm going to percuss for the lower liver margins. There we go. And now I'm going to percuss for the spleen, starting in the cardiac dullness. Going in the anterior axillary line, down to the costal margin, tragus space. Then we're going to have you stand up again. Sorry. And you can look this way. And I'm going to percuss the costal vertebral angles with the ulnar surface for any tenderness. Any pain?
No.
Okay. So now I'm going to do the MSK exam. That's okay? Awesome. So first, starting with inspection, I'm inspecting for any asymmetry, redness, joint deformities, swelling, and nothing both sides. Okay. Now I'm going to palpate, starting in the manubrium, going to the clavicle, AC joint, coracoid process, and then greater tubercle, and the biceps tendon, and then the supraspinatus, infraspinatus, teres minor. Any pain with that?
No.
And the same on the other side, starting on the median, clavicle, AC joint, coracoid process, radial cervical, biceps tendon. Any pain?
No.
And then supraspinatus, infraspinatus. No pain with that?
No.
Okay, so now I'm gonna have you do some motions for me. That's okay? So first, flexion, extension, adduction, abduction, external rotation, internal rotation. Any pain or difficulty with that?
No.
So now I have to do it for you. Flexion, extension, adduction, abduction, external rotation, internal rotation. Flexion, extension, adduction, abduction, external rotation, internal rotation. Any pain with that?
No.
No. Okay, so we're going to proceed to the elbows now. I'm inspecting the elbows for any asymmetry, joint deformity, swelling, or redness. And now I'm going to palpating the medial lateral epicondyles. And the olecranon. Any pain with that?
No. It tickles.
And there's no displacement of the olecranon. No pain with this? No. Okay. So no tenderness on palpation, bilaterally, and no swelling. Okay. So now I'm going to do range of motions of the elbow. I'm going to ask you to flex, extend, pronation, supination. I'm going to do it for you. Flex, extend, pronation, supination. Flex, extend, pronation, supination. Perfect. Any pain with that?
No.
No. Okay, awesome. I'm going to inspect the wrist, the dorsal surface, and the palmar surface for any swelling, redness, joint deformities, or asymmetry. And both are symmetrical and normal bilaterally. And now I'm going to palpate the distal radius, distal ulna, and the, can you do like this for me? Anatomical snuff box, and all the carpal bones for any swelling, tenderness, any pain with this?
No.
And the same on the other side, the radius, ulna, joint line, and then carpal bones. Can you do like this? And then the anatomical snuff box. Any pain?
Nope.
No. Okay. I'm gonna ask the patient to do the range of motions. So can you extend for me, and then flex, and then radial deviation, and then ulnar deviation. Okay, awesome. And I'm gonna do it for you. Extend, flex, radial deviation, ulnar deviation. Extend, flex, radial deviation, ulnar deviation. Any pain with that whatsoever? No? Okay, so we got to the fingers. So I'm just checking for any joint deformities, any redness or swelling, right?
Mm-hmm.
And the palmar side as well. Everything's normal bilaterally. And now I'm going to palpate the MCPs, PIPs, DIPs, and then this is the MCP and DIP. Okay? The MCPs, PIPs, DIPs, MCP, DIP. Awesome. Any pain with that?
No.
So I'm going to ask you to do some movement with your fingers, okay? Flexion, extension, abduction, open arm, put them adduction. Awesome. And then your thumb, I'm going to ask you to do flexion in, extension out, abduction out, and then abduction in, and thumb opposition. Okay, awesome. Flexion, extension, abduction, abduction, and then flexion, extension, adduction, abduction, and thumb opposition. Okay, and then flexion, extension, abduction, adduction, and then with thumb I will do flexion, extension, abduction, abduction, and then thumb position. I'm gonna do muscle strength of the upper extremities, okay? So I'm gonna have you go like this and resist my movement up. Awesome. And go like this for me. Resist my movement down. And the same, resist my movement up. This way. Okay. Awesome. And then when you open your, when you go like this, and can you resist my movement? Awesome. This.
Okay.
And then resist my movement.
Okay.
Awesome. That works, huh?
Yeah.
So, can you open your fingers for me? Can you resist my movement? Okay, awesome. Can you go like this? And resist me, try and open it. Okay, awesome.
That's great. Here's
Can you squish my fingers? Tight, tight, tight. Okay. I'm gonna do now lower MSK exam. And first, I'm going to inspect. I'm gonna inspect the knees for any redness, joint deformities, asymmetry, or swelling. And everything's normal bilaterally compared side to side. And now I'm gonna palpate the meniscus or the joint borders for any tenderness or swelling, and also the patella. Okay? Okay. And then do that bilaterally. Okay? So there's no tenderness or swelling on palpation bilaterally. Okay? So I'm gonna have you do some movements for me in the knees, okay? So it's just gonna be extension and flexion. Okay, awesome. So I'm inspecting now the ankles for any asymmetry, joint deformities, swelling or redness. And everything's normal comparing right to left. And now I'm gonna palpate the medius malleolus and just the ankle joint for any tenderness or swelling. No pain with it? No. And the same on the other side. Lateral malleolus, medial malleolus. Okay, awesome. And I'm gonna ask you to do some movements with your feet, with your ankles. So plantar flexion, dorsiflexion, internal rotation, and external rotation. Okay. And I'm gonna do it for you. Dorsiflexion, plantar flexion, internal rotation, external rotation. Dorsiflexion, plantar flexion, internal rotation, external rotation. And the movement with the knee. So I'm gonna do it for you. Extension and flexion, extension and flexion. Awesome. Okay. So now I'm going to inspect the feet and the toes. The toes for any joint deformities, redness, swelling, or edema, and they're normal bilaterally. Okay, so now I'm gonna palpate the feet, starting in the calcaneus, going down the plantar fascia, and also in the tarsal bones, and then in the toe joints for any tenderness, swelling, bilaterally, starting in the calcaneus, plantar fascia, and then any pain?
No.
Tarsal bones, and then the toes. Okay. No pain with that, right?
No.
And I'm going to ask you flexion with your toes, and then extension, and then open up and close them. Okay. So now I'm going to do reflexes. Can you just relax your hand here? I'm gonna do bicep reflex. Yes.
Yeah.
Okay. And then here, just relax your hand. There. Okay. And then now I'm gonna ask you just let it fall on my hand. Let it fall here. Yes. Okay. Can you just let your hand fall on me? Let it fall. Okay. Yeah. I'm gonna do brachioradialis. Just putting it there. Okay. Oops. Same bilaterally. Awesome. Okay, so now I'm gonna do patellar reflexes. Okay. And now I'm going to do the Achilles. Just relax. There. Awesome.
Miss Kane.
So we're done with the MSK exam, and now we're gonna do a little bit of our neuro exam. So we don't do the full neuro exam due to COVID. We haven't learned the complete cranial nerves exam, but we do some maneuvers with the rest of the body. I'm gonna do muscle pulse. Do you have any pain?
No.
How about here? No pain. No pain here?
No.
How about here? No pain? Okay, awesome. And I'm gonna have you come down for me. And just walk that way and come back to me. Okay, so she has a normal gait, and I'm going to ask you to go against the wall and try to do a wall push-up. I'm just observing for any scapula. Go up. Okay, awesome. You can come back and go that way. I'm going to be inspecting the back and also the hips for any deformities, and also palpating the anterior and posterior superior iliac spines. Any pain with that?
No.
Okay. Okay, now I'm going to do range of motion of the hips. Can you lean forward all the way back? All the way back now? Okay, awesome. And now can you do lateral bend to the side, to the other side? And then I'm going to do rotation this way, rotation that way. Okay, awesome. You can have a seat now. Okay, so now I'm going to do the neuro exam first with the soft touch and then with pinprick, okay? So C5, C6, C7, C8, C1, C2, C5, C6, C7, C8, C1, C2. Do you feel both the same?
Mm-hmm.
Yeah. And now I'm gonna have you tell me if it is soft or if it is sharp. Okay?
Mm-hmm.
Okay. So
Sharp. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. 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 Soft. Soft. Sharp. 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 Soft. Sharp.
okay. So sensation intact to pinprick and soft touch. Okay. Okay. So now we're going to do the same for the lower extremities. And let me know if you feel soft.
You're fine.
Yeah. Okay. L3, L4, L5, S1, S2, L3, L4, L5, S1, S2. Good. I'm gonna ask you if you're feeling soft or sharp. Okay?
Okay.
Okay.
Sharp. 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 Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft.
Okay. Thank you. So I'm going to show you how this vibrating tool feels, and then I'm gonna have you close your eyes. Okay? So this is how it feels. Okay. And now I'm gonna ask you to tell me when it starts and when it stops. Okay?
Okay.
Close your eyes for me.
Start. Stop. Start. Start. Stop. Start. Stop. Start. Stop.
Okay, awesome. So sense to vibration is intact.
The
I'm gonna have you do some movements for me. Go like this, and back, and like this, and back. Awesome. Thank you. And now I'm going to just have you close your eyes. And this is up and this is down, right?
Mm-hmm.
I'm gonna ask you to tell me when it's up and when it's down, okay?
Yep.
Now?
Down. Up. 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 Down.
Okay. And the same with this one. This is up and this is down.
down, up, down.
Okay. So I'm going to ask you to start with your finger in your nose and then go towards my fingers, okay?
Do you want me to extend it a little more?
Yes. Go. Go. And then back to your nose. Back to my finger, your nose. Okay. Thank you. Sorry. I feel like I'm gonna screw up with my stethoscope in the day.
You're good. I hate when it gets caught in your hair. That's like the biggest
Yes!
thing. Always gets
Oh
caught
my
in my hair.
Okay.
Okay. Like, don't let your fingers touch.
And you're letting it go.
Dude, it's hard. Here.
Yeah! Oh my god. Okay.
Don't make fun of my weak fingers.
Okay, let's try this again. Let's try this again.
We got one heck of a blooper reel.
Okay. Also, the medial, what's it called this?
Oh my gosh. I can think.
I have it on my tongue.
Sorry, they took it out of me.
Medial lateral malleolus.
There it is. Okay.
Malleolus. Okay. I'm sorry. I'm not gonna do that.
No, we're just gonna cut it out. Nobody's gonna see this. This is secret footage.
Okay.
I don't know if we
And
do
then-
movement with the toe. I'm not sure.